Okay, it's 12:30 on the nose, so I'm going to begin. Good afternoon and welcome. I am Beth Battolino, CEO of Healthy Women. And on behalf of CancerCare and Healthy Women, I am delighted to welcome you to our conversation today on the cost of cancer. Did you know that nearly 2 million Americans are diagnosed with cancer each year? Though cancer remains the second leading cause of death in the United States, screening, prevention, and treatments have improved, and mortality rates for many types of cancer have dropped. As the survival rates increase, unfortunately, so does the cost of treatment. Cancer is actually considered one of the most expensive illnesses to have. And many of those living with cancer simply cannot afford to focus solely on their health. They must also confront the direct and indirect financial costs associated with their diagnosis, which we know disproportionately affects women and people of color. Healthy Women and CancerCare set out to understand the impact of cancer-related costs on post-treatment survivors, caregivers, and those currently living with cancer. Last fall, we conducted a nationwide survey which revealed some harsh realities. The financial burdens for treating and managing a cancer diagnosis creates emotional distress, it creates depression, anxiety, exhaustion, and a sense of powerlessness. Many people are forced to adjust their lives and put off their care they need because they can't afford it. Simply put, choosing between life-saving treatments and paying bills is a choice that no one in this day and age should have to make. Today, we have brought together an esteemed panel to discuss the financial and emotional burdens experienced by those living with or caring for someone with cancer. And we're offering resources to help provide support. Both Healthy Women and CancerCare are dedicated to supporting women and the people who love them with information, with tools, and resources so that they are better positioned to address the difficulties and to reduce the barriers necessary for care. I invite you to visit healthywomen.org and to visit cancercare.org after the webinar to learn more about today's critical topic and to find useful resources to hopefully help you navigate these issues. And now, I am honored to welcome our moderator, Shruti Kulkarni, AIMED Alliance Counsel. Shruti provides insight on federal and state legal, legislative, regulatory, and enforcement matters affecting healthcare delivery. Her work includes analyzing existing and proposed legislation, regulation, and policies, drafting legislative and regulatory language, developing white papers and policy positions, and educating federal and state legislators and regulators about the patient impact of specific policies or proposed actions. She's also a principal at Sequel Legal, where she counsels pharmaceutical, biotech, and medical device companies and not-for-profit organizations. Ms. Kulkarni has more than 15 years of experience in the healthcare industry, including working for various pharmaceutical companies in government affairs and sales positions. Immediately prior to joining the firm, she worked at the U.S. Food and Drug Administration's Office of Policy. Thank you all for joining us today. I hope that you leave feeling more informed and empowered. And I want to thank you. I want to send a big thank you to Amgen and Daiichi Sankyo for their generous support in helping us shine a light on how cost amplifies the challenges of cancer, but more importantly, provide resources to people who are navigating this difficult course. Now, I will turn it over to Shruti. Thank you, Shruti.
Thank you, Beth. Luke, next slide. So today I'll be going over the cost of cancer, the impact of cancer-related financial burdens on emotional well-being. Next. I work for AIMED Alliance, which is a not-for-profit organization that seeks to protect and enhance the rights of healthcare consumers as well as providers. Next. CDC projected that cancer-related healthcare would reach $174 billion by 2020, an almost 50% increase from 2010 and outpacing the growth of the US gross domestic product. Cancer costs, which account for 5% of total US healthcare expenditures, are projected to reach $246 billion per year by 2030. As such, CancerCare and Healthy Women partnered and sought to understand the impact of these costs on cancer patients, survivors, caregivers, and to examine how cost burdens may disproportionately affect women and people of color in the United States. They surveyed over 1,000 respondents, and they included people with active cancer diagnosis, remission of less than 5 years, survivors, which is categorized as remission for 5 years or more, and unpaid caregivers. In terms of the demographic, it was 70% women, 34% caregivers. The racial and ethnic composition was also similar to the distribution in the United States, and just virtually everyone was insured, with the large majority being on Medicare. So what did they find? They found that the cost of cancer was a big consideration for many respondents. 41% considered direct and indirect costs when beginning treatment, and 60% of those found the cost to be stressful. This is on top of the cancer diagnosis. Most participants, 77%, considered direct costs when they thought about how cancer treatment would affect them. Direct costs are those that are associated with cancer treatment, such as out-of-pocket costs for medical care and medications, including co-payments, deductibles, doctor's visits, and tests. What was interesting was, even after originally estimating their costs to be in thousands of dollars, for example, 61% of participants expected their direct cost of treatment to be $5,000, and nearly a quarter estimated their cost to be $25,000 or more. Many respondents still underestimated the cost of cancer. 49% reported that their actual treatment costs were higher than expected, and 20% reported that they were significantly higher. Next. The financial impact of cancer also extended beyond treatment costs. Respondents identified opportunity costs as contributing to the total cost of cancer, including lost income due to time away from work. 56% reported that, a change in employment status, which affected 57% of the respondents, and loss of health insurance, which affected nearly 40% of the respondents, which is tied to employment for half of the US population. Many respondents who faced these increased costs from cancer treatments simultaneously also suffered economic setbacks. 37% experienced some change in their employment status, including nearly 50% currently in treatment, and 6% lost or left their job altogether. 56% of patients and 49% of caregivers lost income due to time away from work. Next. However, it's important to note that discussing costs with HCPs often did lead to savings. 77% of those who discussed costs did receive information, and 70% of those who discussed costs were offered lower cost options. But what's also important is that nearly 50% did need help paying for those direct or indirect costs. 14% had received financial assistance, and financial assistance is usually in the form of copay assistance or discount card from drug manufacturers. Though less common, some respondents had taken more extreme actions, such as taking out private loans, refinancing, selling their homes, or even declaring bankruptcy. What was really notable was that 8% had delayed or changed or gone without treatment because of cost, and nearly 8% went without groceries due to costs of cancer. Next. Costs got in the way of other healthcare needs as well, with nearly 20% reporting that they put off preventative care, 60% reporting that they put off non-cancer related care, and 10% putting off elective surgeries. It also created emotional distress, depression, anxiety, exhaustion, and a sense of powerlessness, with caregivers who are more likely to be actually affected by these psychological impacts than patients. Next. Costs were also a huge factor in treatment decisions for many and a barrier for recommended treatment for some. 44% considered the financial impact of their treatment decisions, and 26% adjusted their treatment plans in some way, either by changing or foregoing the treatment or medication. The financial burdens of cancer also affected women, people of color, and people with lower incomes disproportionately. People in these groups suffered more financial hardship, took more actions to manage their costs, and were more likely to make sacrifices or forego treatment in order to pay their bills. Nearly 50% of people who earned less than $45,000 reported a change in employment due to cancer, which is statistically different compared to the higher earning groups. Let's also look at the demographic. 65% of Hispanic or Latino Americans, 53% of Black Americans, and 42% of Asian or Asian Americans had a change in their employment compared to 27% of white Americans. So just to reiterate, the financial burdens do affect women and people of color disproportionately compared to everyone else. With that, sorry, my part of the presentation was a little depressing, but we will be going to our next speaker who will be giving you her story. So let me introduce Rhonda Smith, who is the Executive Director of California Black Health Network. Rhonda is a 13-year breast cancer survivor and has parlayed her experience into passion for community engagement, advocacy, and policy work to address healthcare disparities. Rhonda currently serves as the Executive Director of California's Black Health Network. She was the Executive Director of LifeServe Youth Foundation as the Interim Executive Director for Integrative Medicine for the Underserved. Prior to her tenure at IM4US, Rhonda was the Consultant Project Director for Live Healthy OC Initiative, a 3-year initiative that aimed to transform the model of care of a network of FQHCs from disease-focused treatment model to prevention and wellness model, providing whole person care approach. Before Live Healthy, Rhonda served as a consultant, statewide project manager at the Susan G. Komen Circle of Promise California Initiative, an intensive 4-year effort to identify evidence-based strategies to decrease the high mortality rate of African-American women diagnosed with breast cancer and address disparities at the system, community, and the individual levels. Rhonda earned her MBA in Marketing and Operations Management from the Darden School of Business at the University of Virginia and her bachelor's in Civil Engineering from Virginia Tech. With that, I will give it over to Rhonda Smith. You're still on mute, Rhonda.
Great, thank you very much, Rudy. So can you go to the next slide, please? Yeah, so first of all, thank you to Healthy Women for the opportunity to participate in today's panel and an important discussion on the impact of cancer and sort of non-emotional, I guess you can say emotional as well as non-emotional ways. But I want to start by sharing not only my breast cancer journey, but also my experience and journey sort of walking alongside my mom, who was also a cancer patient. And so I've had the experience of being a patient, a caregiver, and a patient advocate, and also a self-advocate as part of that experience. And then I'll talk about my lessons learned and touch upon a little bit of my experience and my role with the California Black Health Network. So for me and my journey, at the time I was diagnosed in 2008. And so I was self-employed and single, and was prepared for going through the experience of treatment and getting over my diagnosis. And unfortunately, I went through that process the second half of 2008. So near the end of that year, the economy was in the tank, and most of my stress was because of lack of opportunity. So I fortunately had a nest egg built up to support myself during the time that I took off from work. And then also I had really good health insurance. And so the cost burden to me was not as much during my treatment as it was dealing with life after treatment. So my concerns from a cost perspective was being able to continue to support myself and finding other opportunities. And so a little bit different for my mother's experience. And so for us, and it was just the two of us because my father's deceased and I'm an only child, the challenge was finding ways to cover the cost of her oral medication in addition to her infusions that she had every other week. And so her oral medication copay was about $1,200 a month. So my mom was retired and on a fixed income. Fortunately, because of one of the cancer institutes that we were connected to, we were able to get her a patient assistance grant, and it pretty much covered her entire copay. So that was a big relief for both of us. But then there were other cost burdens that we had to deal with, sort of ancillary costs. Because of my mom's cancer diagnosis, which was multiple myeloma, it became a very debilitating disease for her. And physically, she wasn't able to do all the things that she enjoyed doing as an independent senior. And then also her diagnosis caused her to have to go on dialysis. So but her quality of life was compromised and changed significantly because of her disease. And so it became, on top of being able to find a solution for her monthly copay, it became also another challenge to find assistance for her when I wasn't physically able to be here in Virginia with her. And so finding in-home care was a challenge because my mom was sort of in that gap of she didn't make the right income in retirement to qualify for benefits. And so she made too much to actually take advantage of some of those resources. So we were stuck in the middle, but I was able to figure out ways to get around that by tapping into sort of our community here and our network to find someone who was able to step in and take care of her and make sure she got what she needed while I was back in California working and taking care of my affairs there. And so for me, the lessons that I learned throughout that process, I think from the very beginning, not only having insurance, but also making sure that you have really good insurance and the type of insurance, and knowing what is covered by that insurance is very important. Secondly, related to your diagnosis, I think it's really important to understand what you're up against in terms of knowing exactly what your diagnosis is, including the type of cancer, the stage of cancer, and what the treatment options are, so that you not only prepare yourself for what you have to deal with physically and maybe emotionally and mentally, but also from a cost standpoint. So hopefully having that information up front will enable you to plan better and know what adjustments you may need to make given your situation. And for me, it was good to learn from other people's experience in terms of what to expect, but also about what other resources were available within the cancer center that I was treated at, as well as at the community level. And at some treatment centers, there are patient navigation services and resources. So I strongly recommend that anyone facing a cancer diagnosis find out if those resources and type of support is available at their cancer center. Outside of that, there are local nonprofits and state organizations and also national organizations that do provide financial assistance for patients. You just have to do a lot of research and spend the time really combing the internet and making sure that you find those that are legitimate. But there are several resources at all those levels to take advantage of to provide financial support. And then in my case, as well as my mom's, I was able to advocate for myself because I was, working already in the healthcare space, and then knowing what to do, not only for myself, but for my mom, and knowing what we had the right to as patients is important. In addition to that, my mom had cancer insurance, which sounds great, but when it came down to it, it really only covered just minimal monthly expenses, to cover like the electricity bill and some other things. So it really wasn't that significant in terms of providing financial support, although it did help. And I think there's also what I call the hidden cost of cancer, and outside of the actual cost for treatment and other things related to that, it's the mental, emotional, and spiritual toll that it takes on not only the cancer patient, but also the caregivers and the family. And it varies based on your situation, but it does take a toll in other ways that may not have some monetary value attached to it, but there is a cost. And then the other thing that I wanted to address, and I think Shruti kind of touched upon this in her intro and summary of the research, is around what happens to folks from underserved communities and under-resourced communities who may not have the luxury of, making the kind of income that can support them and their families should they receive a cancer diagnosis. And so, in addition to that, I call it the cost of the social determinants of health. And unfortunately, oftentimes, someone's zip code determines not only the quality of their life, but how long they live. And so that typically happens and is very reflective of underserved and under-resourced communities where there may not be a cancer center or even an imaging center to get screened. And folks have to travel, outside of their community to get access to resources. And so a lot of times they just don't get screening for cancer because of the lack of resources and access in that regard to those type of healthcare services. And so then access to healthcare coverage, as I mentioned before, is important, but also the type of coverage that you get and how the system may work or maybe not work in some cases. Unfortunately, in California, so it's kind of the double-edged sword. So if you are uninsured and also undocumented in California, there are resources and access to healthcare services that you can take advantage of. Unfortunately, I've heard stories where women, especially with a breast cancer diagnosis and a late stage diagnosis, and maybe even like a triple negative diagnosis, may succumb to the disease just waiting to go from a diagnosis or confirmed diagnosis into treatment. So there's the cost of life in that situation. So unfortunately, even though there are services available, it may not be the most efficient resources. And then, cancer treatment itself, it's toxic, but we talk about the financial toxicity. So someone who has to make the trade-off between feeding their family or covering their utility bills or rent or mortgage, there's that as well. So it's a really tough position to be in, to have to make the trade-off between those two and balancing all of that. And so I believe, and I hope that one day we can all get to the point where we have access to healthcare coverage regardless of what we look like, what country we're from, how much money we make, where we live, or what our education level is, because I believe healthcare is a right and not a privilege. And I think until we get to that point, there's still going to be the cost associated with dealing with the cancer diagnosis and going through treatment. So that's it for me. So hopefully I stayed within my 7 minutes. So any questions, happy to entertain.
Thank you, Rhonda. Thank you for sharing your story, and thank you for making those great points about disparities. So given what you've been through, what is sort of the one piece of advice you would give others that are going through the same thing? I'm thinking of, is there anything you wish you had known when you were first diagnosed that you do now?
Well, I think for me, it would have been great to know and have greater understanding of the lingering effects or the after effects of cancer treatment and what that really means. Of course, cancer treatment affects everyone differently, but I wasn't prepared for how I was actually affected. I just assumed that when I was done with my last radiation treatment and I went through surgery, chemo, and radiation, and I thought, oh, I'm done with radiation. Now I can get my life back and live my life the way I knew it before this all happened. But I wasn't the same person in a lot of ways, not physically, not mentally, not emotionally, and certainly not spiritually. And so navigating through that phase of my journey was extremely difficult. And then finding work. And so, so for me, I did not have disability insurance. So that would be something that I would strongly recommend people look into so that there's some coverage and support. Should you end up in a similar situation or not be able to work, you're still able to cover at least the majority of your living expenses and not have to worry and add additional stress to your life about that. And I guess the only other thing is, make sure you ask a lot of questions, not just about your diagnosis, but about resources, and do your own research and due diligence to find resources that are available for cancer patients that can help provide financial assistance, and just be persistent about it. Sometimes, people that you ask who actually work in healthcare may not know everything, but it could be the starting point to open the door for you to understand, what resources are out there. But in addition to that, I think it's important to do your own research and find out from others who have gone through this experience before you what they know and what recommendations they can make.
You made some really, really good points. First, it sounds like, you made a great point that just you think that after chemotherapy, after radiation, that's it. But no, you wish you understood the after effects and that it's a long journey. Second, I think you made a great point about disability insurance and something you had not thought of. So that would be great for the audience today. And then the last point you made, I think, was very important as well, which is asking lots of questions and being persistent, and not just for your healthcare practitioners, but everyone. Everyone might be able to offer insight. So asking lots of questions and being persistent is absolutely key. So thank you so much, Rhonda. That was very, very helpful. And with that,
you're welcome.
With that, I'm going to go over to Darcy Burbidge. She is an oncology clinical nurse specialist, director at large, Oncology Nursing Board of Directors. Darcy has over 30 years oncology nursing experience and has worked with patients in a variety of settings, including inpatient care, clinical trials, community outreach, and was the first oncology nurse navigator at Christiana Healthcare System in Newark, Delaware, where she developed and implemented the role of the nurse navigator in breast care and in survivorship and palliative care. She currently works as an oncology clinical nurse specialist in Newark. In addition to her clinical experience, she's currently serving as the board of directors for the Oncology Nursing Society as director at large, and is currently on the professional advisory board of the Cancer Support Community in Delaware. She has authored articles, books, book chapters, online courses, as well as presented locally, nationally, and internationally on multiple oncology topics, and is the past recipient of the Pearl Moore Making a Difference Award. Darcy is passionate about mentoring new oncology nurses and in helping patients maximize their quality of life. With that, I present Darcy.
Thank you, Shruti, and thank you for inviting me to present alongside my esteemed panel. And Rhonda, thank you so much for sharing your story. That was wonderful, and I, can relate to a lot of that based on the patients that I've cared for in my career. It's such an important topic. financial toxicity, as well as helping patients maximize their quality of life. It's, as an oncology nurse, patients look to us as trusted and knowledgeable experts about care. So it's essential that we know how to ask and address issues such as financial toxicity. Next slide, please. The economic burden and growing significance of the high cost of cancer treatments have steadily increased in recent years and continues to rise with newer treatments such as immunotherapies, as well as the ongoing cost to patients who are on maintenance therapies. In addition to the cost of cancer itself, as we talked about earlier, living expenses are also impacted by the cost of cancer treatment, such as mortgage or rent, transportation, including gas, bus money, parking fees, food, utilities, as well as finding child and elder care. Oftentimes, our patients can't take time off from work because they need the money to pay for treatments and also need to maintain their insurance. And they're continuing to work if they're experiencing fatigue or neuropathy from the treatments that they're receiving. Long-term regimens are also likely to exacerbate the problem of financial distress, particularly in the cases of long-term treatments such as endocrine therapies, as well as those individuals living with metastatic cancer. Having insurance does not exempt individuals from financial distress. Individuals from all socioeconomic groups experience this because of high out-of-pocket expenses, as we discussed, deductibles, out-of-pocket costs, over-the-counter medications. If you're undergoing radiation therapy and you need to continue to get creams to help reduce that skin reaction, or if you suddenly have an ostomy now and need to purchase new garments and clothes. DME, which is if you need durable medical equipment, if you have breast cancer or other types of cancer and need a garment to help reduce lymphedema. Sometimes that's not covered by insurance as well. And as we talked about earlier, it's the reduced income while being treated or recovering from treatment. And as Rhonda touched upon, insured patients are often surprised by what their insurance doesn't cover and have been taken off guard by, these additional expenses. Other costs related to cancer care are the lack of a cost transparency, meaning there may be a facility fee, a technical fee, and a clinician fee, all for the same tests. And clearly, individuals, in addition to that, many resources are limited to those that are uninsured or underinsured. So everyone needs assistance because of this high cost of care. Next slide. This word cloud is what I put together as I've heard from patients describing their experiences with financial toxicity. In some instances, patients have had to make decisions such as skipping treatments or visits to reduce costs, or have had to borrow money or use credit. Sometimes patients are too embarrassed or fearful of sharing this information with their healthcare team, as they're concerned if they bring up the cost of care, they will receive less quality care, leading to additional anxiety. Preliminary data also suggests that financial toxicity may be a barrier to clinical trial participation due to a lack of access and practical support, such as transportation or lodging near the study site. In one study, over 40% of newly diagnosed patients with cancer depleted their assets within 2 years of being diagnosed. In another study, greater than 70% of patients indicated that they were worried about financial problems related to their cancer. And as we heard, patients have skipped paying non-medical bills, and over half did not have enough money in their savings to cover bills from their treatment, which is a precursor to debt collection. Financial toxicity is associated with non-adherence to treatment that extends to all aspects of medical care. Several studies have revealed that patients reported discontinuing prescription medications because they could not afford it, or have stretched their prescriptions by taking less than the prescribed amount due to the cost associated with their cancer therapy. Patients have also reported foregoing or delaying care, skipping follow-up visits, and additionally, patients have reported a 50% reduction in spending on food and clothing and using savings to cover out-of-pocket expenses. And as we heard from both Shruti and Rhonda, individuals with cancer experience financial toxicity, in addition to those that are of people of color who live in high-risk zip codes, also individuals who have other health conditions. If you also have cancer and you're diabetic or have heart disease and are trying to manage those multiple issues and health issues that also come with their own financial issues. And also those individuals living with advanced cancers, which are estimated to increase as cancer screenings have decreased due to the COVID-19 pandemic. Those that have a higher or lower income at baseline are all associated with a greater economic burden and increased financial toxicity, which impact health outcomes, leading to a decrease in quality of life, and in the worst case scenario, bankruptcy. Next. Although addressing and intervening to assist patients through financial toxicity will require an interdisciplinary approach, because of the unique relationships that nurses have with our patients, we're usually the first to know if they're having financial concerns. And our role is to assess as well as connect them with the right people and program in our practice and community. And to those healthcare providers who are listening today, it's not a one and done conversation. It is an ongoing conversation as financial circumstances are likely to change over time. Most often, we're fortunate to have social workers in practice that can best assist patients that sometimes they either have difficulty accessing financial services that are necessary and that they are in need of, or they're not aware of the resources at all. A lot of times I have patients say to me, Darcy, I don't even know what I don't know to ask you a question. What I also do is ask patients to keep track of everything. So any EOBs, any bills, anything that they receive, and also to request a case manager through their insurance company, just to help them understand their individual policy, because there's so many different carve-outs with the policies that are available. And as we know, treatment decisions are made by patients with or in consideration of their families, because the reality is cancer affects the entire family unit. And although receiving a cancer diagnosis is difficult at any time of the year, during and immediately following holidays or when a new benefit cycle occurs can be especially tough. And now, as a result of COVID, which represents an unprecedented health and economic crisis that will have far-reaching implications, and our patients with cancer are particularly vulnerable, especially if some of them may have lost their incomes, jobs, and resulting insurance. I'm also hearing from community agencies and food banks that they're experiencing less donations, so there's fewer resources that are available. As it's so prevalent, it's also important to begin the conversation early to help normalize the conversation of the financial component of care, as well as to help empower our patients to seek assistance. In my practice, we've developed scripts and coached members of our healthcare team, such as the scheduling department, rehab, infusion center staff, on how to ask questions to our patients, which can be sensitive to discuss. For example, we have developed a question. Have you had any changes to your income since your last visit with us? Or some of my patients have expressed concerns how they will pay for treatment. Is this a concern of yours? We've also incorporated discussing financial issues at our multidisciplinary tumor board. One, because the entire team is there, so we can provide the most comprehensive and holistic care to our patients as early as possible. In studies where healthcare providers discussed costs of care or utilized a quick screening tool to assess for financial concerns, it allowed for early identification for individuals at increased or rising risk, and effective interventions which led to improved outcomes and increased quality of life. And last, but certainly not least, is to advocate for policies that address underlying causes of financial toxicity, such as oral parity, pre-existing conditions, decentralizing clinical trials, as well as lowering healthcare premiums to improve access to quality, affordable care. Thank you.
Thank you so much, Darcy. That was very, very helpful. So my question to you would be, what are some of the most common access barriers that people with cancer face? I think you went over some of them already. And also, what can patients do to advocate for themselves with their healthcare practitioners, legislators, and maybe even policymakers?
Great. Thank you, Shruti. That's a great question. When I think of barriers, a few come to mind. One, healthcare is confusing. Medical terminology is a whole new language that you're being asked to learn relatively quickly after being diagnosed with a cancer and, a potential life-threatening diagnosis and dealing with so many emotions. In addition, besides what we've been talking about, affordability or the cost of care, transportation is a huge barrier. So I want to say, accessibility to care. So if you don't have a car, if you don't drive, if you don't have a credit card to, call an Uber or Lyft, if you can't afford public transportation, or if you live in a rural area that does not have public transportation, that's going to be a barrier accessing care. In addition, if English is not your first language, or if you have physical challenges such as you're blind or need assistive devices, and then you go to a doctor's office and what do? And you stack of papers to fill out. So all of those issues are very important. So affordability, accessibility, and Rhonda touched on this a little bit about the availability of care. So most doctor's offices or clinics work 8 to 4. And if you have a job where it's not easy for you to take off to get to an appointment, or if you're trying to make an appointment with a doctor's office, sometimes you're on hold for I don't know how long trying to get an appointment. And then if you're lucky enough to get through and get to the appointment, what happens? Sometimes you get there and find out the doctor's running an hour behind and you came on your lunch break. So those are all availability issues, such as, another thing I want to mention is if you have to arrange child or elder care. That's also important, especially if you're a single parent or if you live in an area that you don't have access to a lot of individuals that can help you, such as your church family or other resources. And second, to answer the second part of your question, I think the best thing you can do to advocate for yourself if you're diagnosed with cancer is to ask questions and to ask for a nurse navigator. The role of the nurse navigator is to help reduce barriers to care and help improve access. So that's their whole job. And as you heard, I did that job for 20 years, so I know that's what we do. And also studies have shown that has improved patient care outcomes. And secondly, when you're ready, tell your story to legislators and other policymakers, as there is nothing more powerful than sharing your truth. And, as we know, illness and sickness affects everyone. And some of our local and national politicians have also been affected personally by a cancer diagnosis. So continuing to share that story is so important in changing policy.
Darcy, you made some really good points. I think starting off with terminology, especially if so much is being thrown at you that you might not understand, but how difficult it must be, especially if English is not even your first language. So I think you made that, it made a great point about that. I also constantly, when I talk to policymakers and legislators, tell them that there's a difference between accessibility and affordability. And now you put another point, which is availability. So you might have insurance, but that still doesn't mean that you can afford your medications. So there's a huge difference between access and affordability. And then there's transportation, which goes just even beyond that. And that availability is really, really important. It goes back to the point that I made about so much of the population being affected by employment setbacks, because as you said, the office hours are already, very, very short. On top of that, if the doctor's running late, that means you're taking off from work for almost a half a day, if not more, not to mention the chemotherapy and the radiation. So I think you make a really good point about terminology, about access, affordability, as well as availability. And then, yes, definitely ask for a nurse navigator. I think that's a great resource that you provide. And another really important point you made is share, but when you're ready. I think it's important to acknowledge that people get ready at different times and they should only share when they're comfortable. Yes, those stories are very powerful, but so is their mental health. So thank you so much. That was very, very helpful.
Thank you.
With that, I'm going to go over to Christine Barini. Christine is the Chief Operating Officer at CancerCare. In this role, Ms. Barini serves as a key member of CancerCare's executive leadership team with a primary focus on expanding existing and future mission-based programs and enhancing and building organizational support and collaborations. Ms. Barini is charged with overseeing daily operations and provides leadership to functional areas, including social services, human resources, finance, business development, informational technology, facilities, financial assistance, education, and communications. She develops and executes organizational strategies, business plans, and evaluates and revises processes and procedures, and serves as a business partner to the CEO. Ms. Barini most recently served as the Vice President of Corporate Communications and Advocacy at Eastside. In this position, she oversaw the company's internal and external communication functions, the strategic direction of corporate and brand media relations, as well as outreach to and relationships with patient advocacy and professional organizations. Ms. Barini holds a Bachelor of Science in Pharmacy from St. John's University and is a registered pharmacist by training. She has served on the board of directors of CancerCare New Jersey and is chair of Healthy Women, an independent health information organization that seeks to educate, inform, and empower women to make smart health choices for themselves and their families. In 2009, she received the Women in Industry Award from the YWCA of Bergen County, which honors women who have achieved managerial, executive, or professional positions and made noteworthy contributions to their industries. In 2014, Ms. Barini was recognized with an Individual Achievement Award at CancerCare's 26th Annual Festival of Hope Gala for her compassion, concern, and devotion in helping those with cancer. In 2019, Ms. Barini was named as Pharma Voices magazine's 100 Most Inspiring People. With that, I will present to you Christine Barini.
Hello, everyone. Thank you, Shruti. I didn't realize I was going to take up so much time just with what I've done in my past career. I wanted to take this opportunity to really pull together what everyone has spoken about. Rhonda gave an amazing story about her own experience as well as her mother's. And Darcy did an amazing job in regards to kind of pulling it all together. And I loved your word cloud in regards to the barriers and some of the challenges that people have. Can you go to the next slide? I wanted to speak about CancerCare. CancerCare services, we have all kinds of different services, but I'd say we're a national organization. We've been around for 77 years. We help patients, caregivers, and the bereaved, and all of our services are free. We have 3 core pillars that I think are important: emotional, financial, and education, which are some of the key points that everyone spoke about earlier. Rhonda mentioned about having, I wrote it down, the mental, emotional, and practical toll that it takes on you when you have cancer. And I think that's an important thing for us to note here, because a lot of what CancerCare does is we help with counseling as well as support groups. We do a lot of online support groups. We do some face-to-face and telephone in the New York and New Jersey area. We do educational programs with thought leaders across the nation on various topics. We just recently started during COVID because we found there were so many barriers and needs for people to have resources. We all spoke about somehow the need for resources. Well, our case management was started, and that really helps with the practical guidance and information and resources for patients. It's a strength-based, short-term initiative that helps people create a voice for themselves and become self-advocates, right? Because we can only help so much with getting people resources, because as Darcy mentioned, there's not enough available to everyone anymore because there's such a need out there. We need to try to make our people more advocating for themselves. We also help from a publication perspective and financial assistance. And we do have some local community programs in New York, New Jersey, and Connecticut, but we are a national organization. All our phones are actually answered by social workers. They're master's trained and specific in oncology. And I think that's an important point because, as Darcy mentioned, as well as Rhonda and even Trudy, the fact that it's challenging from a terminology perspective, and sometimes you just need somebody to talk it through with. And that's the key point of what I believe CancerCare's uniqueness is in regards to helping people overall. Next slide, please. So I just wanted to give you a high level of our reach of services. We actually had provided over 200,000 services last year in our fiscal year. We had almost 70,000 calls to our Helpline. We had 30,000 hours of staff providing emotional and practical support. Our users used our online Helping Hand service, which is a resource available for people. We actually had 75 different types of programs, similar to this type of program where you have a moderator and you have thought leaders, physicians, nurses, social workers, speaking to people about different topics. And they're varying topics. They could be about a disease state, they could be about anxiety, they could be about loss or grief. We have all kinds of different topics because we have been around for 77 years. We actually distribute publications, and those are available on our website. We actually gave out 1.2 million last year. We gave out 287 wigs and prostheses, and we're looking to find a way to make those more national in our organization. We actually have a really great program called the Pet Assistance and Wellness Program. We recognized early on some people with pets were having challenges keeping their pets in their homes. So actually it's over 1,000 clients that we've helped already. As of today, it's over 1,000 that we've helped people keep their pets within their home. We actually gave out $48 million in financial assistance to 29,000 people. And those are practical needs. Those are babysitting, home care, transportation. There's never enough funding for us to give to everyone. But what we try to do is we try to actually, if we don't have that resource, the social workers will try to find the resource. We actually have a very active website with over 2.3 visits to our website. And we gave out about 3,700 rides to and from treatment during the pandemic. I thought that was important. We actually serve people within all the 50 states, and we actually have a really nice caregiver initiative. And we didn't talk a lot about the caregivers today, but we do have a nice caregiver community initiative called My Cancer Circle. And we served over 32,000 people there. On the next slide. This was actually an interesting initiative that we did. We actually brought in some patients to come in and talk about their experience with CancerCare. And it's just really, people learn differently. And this is a great visual to see all of the different initiatives that we help with from a CancerCare perspective. I think the key thing is actually we have that toll-free Helpline. We actually help people from an emotional perspective, whether it be group counseling, individual, online. We help from a financial perspective with that child care or elder care, home care, transportation, all those different types of services. We also have a copay assistance program that's available to people dependent upon what funds we have available. And from an educational perspective, we have over 300 educational publications available for people. And I really wanted to thank you for the opportunity to work with Healthy Women. This has been an amazing initiative. I want to thank my colleagues that are on the phone and speakers on the phone. This has been an amazing opportunity for CancerCare to really understand the level and the depth of the challenges that people are having. And what we usually do is we try to identify those gaps and try to address those gaps. So that's a great opportunity for us. We are available. Our website is www.cancercare.org. Our Helpline is 1-800-813-HOPE. And we actually just recently opened up a screening helpline available. I know you mentioned earlier, I think Rhonda, you mentioned it, the challenges from a screening perspective, but we actually just opened up a separate helpline called, which is 1-855-53-SCREEN, available to people to try to help people get screening in this time, because we know that people have delayed screenings and we know that's not a good thing. We understand why, but we want to be here to help. And I think that's the most important thing is CancerCare has been around for 7 years, and we're here to offer help and hope to people who need it.
Thank you so much, Christine. That was great. So you ended up presenting a lot of wonderful resources for patients and some for caregivers, but sometimes we know that people just feel so overwhelmed with everything that's out there. And frankly, they don't know where to begin. So do you have any advice for people on where they should start?
Yeah, I mean, it definitely is overwhelming. I think Rhonda can speak to this personally, but I think the reality is that it's a great opportunity for them to call CancerCare. It is having a social worker help guide you through. One of the key points that we get from people after we've serviced them and helped them in some way is they say they wish they spoke or knew about us sooner, spoke to us or knew about us sooner. And I think that's a key thing. We can help guide you. We may not be able to help you with everything. We may not have all of the resources, but we help make you become more of a self-advocate, help you understand a little bit better how to speak to the healthcare team and the importance of asking questions. As it was mentioned earlier by Rhonda, ask more questions and more questions. We also have a podcast series that we do with patients, and a lot of that is about people really talking about the challenges that they've had. And very similar to what was spoken to today, there are so many barriers that you really do need a guide of some kind. Now, I think the navigator's amazing within an organization, but sometimes when you're out there and there may not be that navigation opportunity, there is a good opportunity to call CancerCare and speak to a social worker.
I think that's great. So many people don't have somewhere they can just simply call. I know that sounds, it just, sometimes you go on the internet, but it's great to have a resource where you can just pick up the phone, talk to a human being, and have them help you through this process. So I think that's a wonderful resource that you guys provide. So with that, I would really like to thank CancerCare as well as Healthy Women for this, for the survey, for this presentation, for all the resources. It was really important for them to conduct this survey so that people are equipped with understanding the full impact of the costs of cancer, and then really understand the disparities that are related to it as it relates to women, people of color. So I think that a survey was very, very important to understand these aspects of the cost of cancer. Thank you, Rhonda, for sharing your story. Thank you, Darcy, for being a nurse navigator and really providing those resources to patients. And then Christine, thank you for providing everything that CancerCare has to offer. We encourage people to please visit healthywomen.org as well as cancercare.org. And we'd like to thank our sponsors, Amgen, as well as Daiichi Sankyo. With that, I would like to open it up for some questions. So the first question we got is there any recommended mobile app which deals with available financial resources for cancer patients? So I can jump in first. I don't know of a mobile app, but one of the things that people with cancer constantly face are denials in care in various aspects, whether that's prior authorization, step therapy. There's just a lot of financial barriers that they face. Aimed Alliance does have a resource called coveragerights.org, where it is a state-by-state resource where it will show you what you can deal with if you are facing any sort of a denial of your care, everything from the internal appeals all the way up to who is the regulatory authority that oversees this and who they can complain to. So I do encourage you guys to go to coveragerights.org if you have any barriers that you're facing. Anybody else?
I'm not familiar with an app itself.
Yeah,
I do know like Triage Cancer has a lot of resources. It's, and also the panfoundation.org. They're specifically for medication. So those are a couple sites that patients can access. They also have phone numbers too. If you don't have access to a computer, you can access that, via phone as well. So we have more work to do for financial toxicity.
No, that's great though, Darcy. That's very, very helpful. So the next question is, does CancerCare offer services or publications in different languages?
Yes. Dependent upon the language. We do have some Spanish available, but we also have a software that can translate some information. It's not perfect. It's, through a Google kind of initiative, but we do have that available. It's called Recite Me. It's at the upper top hand corner. And that's something that we do have available. But our main initiatives, our main topics that we've seen that are needed are converted into Spanish that we have.
Thank you, Christine. Any other questions? Okay. With that, I would like to invite the attendees to again visit healthywomen.org and cancercare.org. And I would like to thank all the presenters for this wonderful, wonderful presentation. So thank you so much.
Thank you.
Thank you.
Thank you.